House Bill 3560. Imagine this. You take your loved one to a private psychiatric hospital for care, assuming every staff member has been properly vetted. But behind the scenes, some of the unlicensed workers, like aides or intake staff, were never checked against the state's misconduct registry because the law didn't require it. What the bill says it does. House Bill 3560 says we'll fix that by requiring all freestanding psychiatric hospitals and mental health facilities to run background checks and verify every unlicensed employee through the state's Employee Misconduct Registry. What it actually does? It gives the Health and Human Services Commission authority to oversee misconduct checks at these hospitals, but only if lawmakers fund it. That means the rules can exist on paper without anyone actually enforcing them. Big hospital chains can still advertise that they meet state standards, even if the state doesn't have the staff or budget to confirm it. Now, who benefits? Large hospital systems like Oceans Healthcare, Acadia Healthcare, and members of the Texas Association of Behavioral Health Systems who can afford to comply and market themselves as state approved. Now, who pays the price? Smaller community hospitals that can't absorb the extra compliance costs and patients who think they're protected when oversight may never be fully implemented. And why this matters. When safety laws depend on funding votes instead of guaranteed enforcement, Texans get promises instead of protection. Families assume their loved ones are safe, but without investigators and public reporting, there's no way to be sure. Now, questions you can ask your lawmakers. If enforcement depends on appropriations, how can Texans trust the law will actually be enforced? Why not make the background check requirement mandatory regardless of funding? And will the state publicly report which facilities are following these rules? Bottom line, House Bill 3560 promises safety, but without funding, it's just paperwork dressed up as protection.